And good morning, I'm Dr. Deuk. I'm here with one of my patients from originally Boston who does a lot of sailing. You found that your back pain was getting involved, interfering your sailing, so you came to the Deuk Spine Institute to get it taken care of. And we found out that his back pain was coming from a few different places, but one of the places he's having back pain was his sacroiliac joint. And for those of you who don't know, the SI joint actually is the joint where your tailbone or your sacrum connects to your iliac bone. You can see it from the back. There's a left and a right SI joint. You can see them from the front as well, the SI joints. So you had pain coming from your SI joint on the right side, and you had the Deuk plasma rhizotomy yesterday. How do you feel?
I feel great. Followed your advice last night and went out and had a great meal, and then walked all the way down the boulevard, and I feel great this morning.
That's awesome. And the pain you had before surgery in your SI joint on the right side?
Gone.
Gone, yeah. And we are using a new technology. We call it the Deuk plasma rhizotomy. And it's basically a very high energy wand that we use to destroy the pain nerves that innervate the inflamed arthritic joint. And when you eliminate the pain nerves, the pain from the joint goes away permanently. And this is a permanent fix. Most other treatments for the SI joint are shots and RFA, and those things wear off and people are back in pain again within a few months. So this is a permanent treatment. We've been doing it now for about 1.5 years, and we haven't had anybody come back with the pain coming back. So you happy with the results?
Ecstatic, yeah. You did a great job. Your team here is all very professional. They do a great job as well. The pre-op, everything is fantastic. The results, you can watch all these videos, but the reality is those of us that have had the treatments here at Deuk Spine, you really can't describe it. A friend of mine has been here as well, and he said, yeah, you'll crawl in and you'll walk out, and that's the truth. For sure.
I appreciate that. Now you had obviously an opportunity to have other treatments for your chronic back pain. How long have you been having back pain for?
Probably several years. It got to be a real pain in my you-know-where for just normal living about 1.5 years ago, and you do the normal thing. You go see a specialist, and started out because of the way the pain was in my hip. I thought I had a hip problem, and the hip doctor, of course, gave me an injection that didn't do anything. And I went...
So he didn't make the right diagnosis?
No, not at all.
Yeah, because it wasn't your joint of your hip, it was the SI joint behind your hip.
Correct. Did that, saw 2 specialists. Basically was horrified by what they told me they needed to do. Talked to my good friend who had his surgery here, and it was, after watching the videos, it's a no-brainer. I have a lot of experience in putting things together and taking them apart, so it just made perfect sense to me the way you do your technique.
Excellent. And you can see in the video right here where we're going into the SI joint and we're using our probe to destroy the pain nerves. It took, that part of your surgery took about 15 minutes to do, and Dr. Patel is the one who did that. And then I fixed the rest of the spine with the Deuk laser disc repair and the Deuk plasma rhizotomy for your facet joints. And here you are, less than 24 hours after your surgery. No hospital.
No.
No bleeding.
No.
No pain meds, right? You're not taking any pain meds from my surgery.
No, nothing.
You have a mild discomfort from where we did the surgery, and you're up walking around.
Oh, absolutely.
Now, why are you wearing one of our hats? You requested one from me. What's the story here?
Most of the videos, you either take your hat off and your hair is all askew, or you have your hat on. And I don't have, I wasn't blessed with hair up here. But the reality is, when you're in the Florida sun.
That's right. You need protection. So now you're also helping us raise awareness of the Deuk Joint Institute. Okay?
Absolutely.
So the Deuk Spine Institute we've had for 20 years now, and the Deuk Joint Institute is a new component to our company where we're treating hip pain, knee pain, shoulder pain. So if you've been recommended for a hip replacement or a knee replacement, you probably don't need it anymore. We're able to go in with a tiny little cut and do the Deuk plasma rhizotomy, which is a patent pending technique, by the way. And that's what you had done on your SI joint. Give us a call if you're interested in learning more about this technology. Is there anything you want to say to your friends and family out there before we wrap it up?
Don't believe everything you hear. Make sure you do your research, and when you get done doing your research, you're gonna come to the Deuk Institute, because they got the techniques and the tools to get it done. And I'm very grateful.
You're welcome, my friend.
Thank you, sir.
All right, you enjoy life, okay?
I will.
And your sailboat. All right, let's get you out of here.